My name is Brittany Boston, and I go to UAM, and today I am here to talk to you about schizophrenia. Here is a very instructive YouTube video about schizophrenia. It lists the causes and symptoms and treatments, and it's very, very interesting to watch. Early signs of schizophrenia. According to schizophrenia.com, people with schizophrenia may have a flat, plain gaze, which is like they just look like a zombie, and sometimes they may even walk like a zombie. They tend to suffer from depression and social withdrawal. They have problems with insomnia or oversleeping, so either they're not sleeping at all or they're sleeping all day. Delusions, which is like them hearing things or maybe even having people in their head talking to them. And hallucinations, which are like more visual, and it seems to me like a movie in their head. People with schizophrenia tend to be disorganized and have disorganized speech or behavior, so sometimes their words get jumbled up. And there's a lot of different names for this, because there's a lot of different types of disorganized speech. And the disorganized behavior is just when they're acting out of character for any certain reason. Schizophrenia can be very unpredictable, so it's best to stay on medication, but that'll be in a few slides. And people with schizophrenia tend to lack enjoyment in daily activities, like all the activities previously enjoyed, they can't go out and just have a good old time. Causes of schizophrenia. One cause of schizophrenia is complications during birth, so if you had the umbilical cord wrapped around your neck or something else happen. Genetics, it's mostly inherited. Most people with schizophrenia did inherit it from one of their parents. It's typical for people to be more at risk when their family is more at risk, or when their family has schizophrenia. Another is childhood trauma, which can include neglect, abuse, and rape in some cases. Malnutrition during pregnancy. So if someone's mother was not well fed while she was pregnant, it could lead to malnutrition in the brain and a lot of issues. And also psychoactive drug use during adolescence, which is LSD and magic mushrooms, and some people may say marijuana. How schizophrenia impacts students. Students face excessive tiredness, which leads to more hallucinations or delusions. So the insomnia that they face can lead to a harder day with more hallucinations or hearing more people talk. These people have trouble staying organized. These people have very poor time management and sometimes deal with disorientation. Children tend to be preoccupied with unusual ideas, such as someone chasing them, or them being heroes, or them getting in fights. It's very, very different. This may cause a significant drop in grades, which is expected when the child or the adult has so many different things going on in their head. I could not imagine. These people have a problem with poor hygiene because they're focused on so many other things. Treatments for schizophrenia. Some treatments for schizophrenia are antipsychotic medication and an anti-tremor medication, because sometimes antipsychotic medication can give you seizures, which is very counteractive, but you have to do what you have to do. Electroconvulsive therapy, which is people shocking people. It's probably the most inhumane of all of these. Cognitive behavioral therapy, which is you learning about your disorder and learning what you can do to handle it, and also psychoeducation is similar. Anti-anxiety medications are usually paired with antidepressants to help people maintain a safe and calm day. And mood stabilizers such as lithium, which is very interesting. Resources for additional information, I use schizophrenia.com, Health Harvard EDU, and YouTube, and many others. My references include Antipsychotic Medication by the Royal Australian and New Zealand College of Psychiatrists, Schizophrenia by the National Institute of Mental Health, U.S. Department of Health and Services, and Schizophrenia Symptoms and Coping Tips from helpguide.org. Thanks.